My name is Julie Workman. I am 61 and I have non-secretory multiple myeloma. My journey began really 3 years before when I was skiing in Mammoth, cracked my ischium. Fast forward about 2 years, it was getting difficult for me to walk upstairs, carrying anything, weight bearing. 3 years to the day, my pelvis blew. I went crashing to the ground in unbelievable pain. They showed me a picture of my pelvis, and my right side looked like Swiss cheese. I have a very dear friend of mine who is a nurse practitioner at a leading oncology facility here in the Los Angeles area. I called her. She said, "Okay, Jules, here's what you need to do. You need to call Dr. Berenson." He looked at all of the test results and said it really looks like a plasmacytoma, but the ultimate test is a bone marrow biopsy. So we did one right there in the office, and he says, "It's not what we were hoping for. You do have 25% bone marrow involvement." I now actually have 2 hematology oncologists. I met with the other one, and he says, "You need to go with the best." I said, yes. So I'm off and running with Dr. Berenson. I was able to think coherently again after the pain and so forth, and responding to treatment. I feel like Dr. Berenson, he's my partner in my treatment. We talk. He will say no, or he'll say, "Yeah, we can do that." A priority not only quantity with his patients, but also quality of life. The dexamethasone part of my treatment, where after 6 years, it was getting very hard. And so I had said that I would rather have bone marrow biopsies more often and maybe stop treatment. And he said, "No, we're not going to do that. The part that's bothering you is the dexamethasone. So let's just stop that." That was life-altering. I felt like I got a day and a half back in my life every 2 weeks, which is incredible. My reality is every 2 weeks when I go into the office for my treatment, it is like a second family to me, but I'm also fortunate that I can walk out and I have a normal existence.